We are rolling.
Okay, we're live?
Okay.
Okay.
Today is very scary. Today we are getting our fat harvest,
Dr. Voss is going to perform liposuction on my wife and I.
which is not really a liposuction, but we're cultivating stem cell from our fat. So, both me and Dave need surgery from like years of pounding on our body.
As you train and push yourself, you obviously run into a lot of different roadblocks and setbacks and bumps along the way.
So for me, I have like torn labrum, like a lot of muscle are frayed.
You know, torn bicep tendons in our shoulder.
I had shoulder surgery on my right shoulder, 2017. It was awful. I mean, everyone who had this shoulder surgery, it's a lot.
Degeneration of joints, a breakdown, very natural deterioration that can sometimes be accelerated by hard training.
Yeah, we fucked ourselves up pretty bad by being the fittest on earth. So that's part of the price to pay.
Liposuction gains.
No, it's not getting work done, by the way.
Ready? It's a big moment. So what we're doing now is, instead of electing to have surgery to fix some of these chronic issues, now we can fix things with regenerative medicine, with things like stem cells and technologies like exosomes to help these tissues heal and remodel naturally.
We're going to follow this up. Now it's a little more defined, so that round thing.
I know I have like a 70% labrum tear that goes down in my bicep, and then I have a bunch of frayed stuff in the back, and that's my medical term for it. With the regenerative medicine now, there's like options that are a lot less invasive.
I'm just going to look at your supraspinatus with...
And surgery involves actually cutting somebody open and, you know, sewing things back together, which can sometimes leave scarred tissue and is a pretty brutal, barbaric process. I'm very interested in performance, but that's not my only concern. I'm getting older, I'm now entering my 40s, and in order to be an outlier, everything needs to be optimal. Everything needs to be finely tuned, and I need to get the most out of my training, out of my nutrition, out of my supplements, and out of regenerative therapies like this that will allow me to do the things that I need to do to be able to be an 80-year-old dude in tight jean shorts, popping out of a monster truck, waking up with a huge pitch tent, loving my wife, and bringing thunder. That's what I want out of my life.
So yeah, that's what we're doing, which is a lot better than going under the knife, and especially with our little Zoe, I just don't think I can afford having another shoulder surgery and a 6-month recovery.
We're working with Dr. Voss. He came highly recommended by a close personal friend of mine, and although we've worked with a lot of different people in the regenerative space, what I liked about Dr. Voss is that he didn't subscribe to any one type of therapy. His practice is very much a holistic clinic that involves a systemic approach towards optimization.
We were trying to figure out someone to kind of do that procedure with, and we talked to other doctor before, and then when we talked to him, we were like, okay.
It's not just stem cells, nutrition, hormone therapies, supplements. He integrates everything and lays out all the options, all the modern technology, so that you can make the best choice for what's going to fit your needs, what you want, and what's going to pair up best with your goals.
Dr. Voss to us felt like he was the best one at that with the most experience, so we're very excited about that. But I'm very grateful that we're like open-minded and like always looking for things, more modern medicine. And I'm just very excited that this can be an option to not go under the knife, because there's no point in cutting your body open if you don't have to.
What I really liked about him too was his view on not just what's happening right now, but what's going to happen down the road. From the time I was a young boy, I knew that I wanted to be able to have boners into my 80s.
I'm not inappropriate. Dave is. Never had a boner.
Cool, you're ready.
Yes.
So what'll happen is we'll take you over, we'll have you get changed, and then I'm gonna get changed too, wash my hands, we'll take you to the procedure room.
The most stressful part right now is to make sure Dave is okay with Zoe while I go. So we're getting liposuction. They're gonna take her fat cell out, and then the way Dr. Voss was explaining to us is that your stem cell are like all around those fat cells.
So he's gonna go in and scrape out the fat, then he's gonna send it off to a company that's gonna culture it, harvest those stem cells and store them for us, and then send them back so that we can get injections in the areas that have pathology in them.
And then you're gonna have a lot of stem cell on the side, and then you use those stem cell and you put it back in the problematic area if it's like a good candidate to have that. All right, how do you look?
When we're getting these regenerative stem cells, we're addressing some really acute issues that we're having, but we're also banking these stem cells for the future, for whatever might pop up.
You know, my knees are not awesome, my lower back's not awesome. They don't need surgery, but hopefully with stem cell, I can completely take the idea that down the line I might need surgery and just inject and let the nanobots do their job.
We're gonna put these away, and I see it as investing capital in your long-term health. I've never seen stem cells harvested. I have no idea what's gonna happen. It sounds a little bit scary to me, and also a bit glamorous.
I'm like nervous about this harvest thing. I made the mistake to go look last night because I was nervous about it, and I Googled it, and that was a mistake.